Hey there, it's Dr. Christopher Fox, Topher Fox, coming at you again. This is Osteoporosis Basics Part 2. If you haven't had a chance to look at Part 1, check the link up there or down below, and you should be able to link over to that video. But I wanted to jump back on. We're going to focus in this training on treatment. Remember, the goal here is that when you and I get together to meet, I want our conversation to be at the highest level possible, which means if you have a basic understanding and have already gone through some of the things that are routine or that I might say every time, it allows us to basically take our conversation, our visit to the next level up to get you your questions answered, your concerns addressed, so that we can make the best decision for you for how to move forward regarding your bone health, how to prevent fractures from occurring, how to treat fractures if those are already occurring. We want to be able to stay at that high level. So let me jump behind the slides here. Again, I'm going to move myself over to this side. Seems to be a little bit better. So again, we're talking about Osteoporosis Basics Part 2. Remember, in Part 1, we talked about osteoporosis, physiology, fracture risk, and bone metabolism, the first 4 parts here. And today, in this training, we're going to be focusing on treatment and prevention. So we talked about osteoporosis being a decrease in the quantity of bone or quality of the bone, which predisposes to fracture. And that a fragility fracture would be a fracture that occurs with low energy in somebody who would not have ordinarily fractured if the bones were healthy. And our goal, the whole reason we talk about osteoporosis, is we want to prevent fragility fractures from occurring. I told you a little story about my hip, which you can see here. I still have that hardware in today, more than 20 years after that fracture occurred when I was 30 years old. We talked about how when we meet, I will typically go through at least these 4 questions. What is your fracture risk? Is there anything damaging your bone health currently? What is the best option for prevention and treatment of fractures? And specifically, what are your treatment preferences when it comes to things like medication? We're going to try to incorporate all of that in so that I can give you the best information available so that you have all you need to make the right decision for yourself. We do respect that at the Alpine Center. So fracture risk and damaging bone health, we talked about that in Part 1. We talked a little bit about these cells, the osteoclasts, which break down bone, digging this little bone pit, and the osteoblasts, which rebuild bone, building it back up. And after about age 30, how whenever we resorb bone, we resorb a little bit more than we form. We break down a little bit more than we build, which leads to a net loss of bone density over time. Ultimately, that can lead to a risk of these things called fragility fractures. And scoop myself out of the way. What I want to tell you now is that fragility fractures, they're bad. You don't want a fragility fracture. I don't want you to have a fragility fracture. I don't want to have a fragility fracture. Boy, having a hard time keeping myself out of the way here. We know that fragility fractures, whether they're in the spine or the upper arm or the pelvis or the hip or the femur, the mid-femur, these cause pain and disability and loss of function. And in the spine, they change the shape of our chest, reducing our lung function. And actually, we know that fractures, fragility fractures, are associated with an increased risk of mortality or dying. And specifically hip fracture, probably the most dreaded complication of osteoporosis. We know that somewhere between 12 and 20% of people will die within 2 years of having the hip fracture. Not necessarily because of the fracture directly, although that can happen. Blood clots, pneumonia, other injuries that occur because of the fracture. And somewhat shockingly, 50% of people who survive hip fracture are unable to return to their same level of function, specifically to independent living. So we really don't want fragility fractures to occur. Now, I'm here to tell you that really why we don't like fragility fractures is that most of you, like me, just want to live a full, healthy life. You want to be able to enjoy other people. You want to be able to travel without pain. And fragility fractures are setbacks that sometimes can impair your ability to be able to enjoy life, to show up in life in the way that you want, both for yourself and for those around you. And it turns out that fragility fractures are preventable. Just like forest fires are preventable, fragility fractures are preventable. When we think about prevention of fractures, we can think about two broad categories. We can think about trying to prevent low bone mass from occurring, and we can think about preventing falls and frailty. And those are related, but somewhat separate. So let's talk about bone mass first. Well, we know that to prevent low bone mass, we want to make sure that people are getting enough calcium and vitamin D. Typically, we think of 1,200 milligrams of calcium. That can be total from food and supplements. So 1,200 milligrams, and as people, we're meant to eat food. So I would prefer you can get that from food sources and use supplements if you need to. There will be, or there is a separate video about how to estimate your calcium intake, simple way to estimate calcium intake, how much is enough, how much vitamin D is enough. For vitamin D, for most people, 2,000 units a day is a great number to start with, and we can actually measure your vitamin D to see if that is sufficient for you. We know that weight-bearing exercise is great. Walking, hiking, skiing, anything that involves a load to the bone, yoga, aerobics. I mean, there's 100 things that I'm not going to name all of them, but any type of weight-bearing exercise is good for bone. And we want you to not smoke. If you're a cigarette smoker, would definitely encourage you to get help to quit smoking. Smoking is bad for bones, just like it's bad for many other things in your body. And we want you to avoid excess alcohol. In general, we think of men being able to consume up to 2 standard drinks per day, women up to 1 standard drink per day. Certainly wouldn't want you to go above this limit. If you were below that, that would be fine. But we want to avoid alcohol in excess. When we think about preventing falls and frailty, we want to maintain muscle mass. And we know that 2 things are most important for doing this, particularly after we get beyond about age 50, is making sure that you're getting enough protein and that you're doing some type of strength or resistance training. If you have questions about that, we can go into that in more detail when we meet together. I want you to be able to maintain your balance. And if you are at risk for falls, potentially to get some formal balance assessment and training, and make sure your environment's safe. We don't want things like carpets or cords hiding around corners where they are ready to trip you and cause you to have that injury that results in, say, a broken hip. Now, a couple of interesting things I will just put in here. So I'm recording this in February of 2022, and I get lots of questions about specific exercises. So if you Google this Dr. Fishman Osteoporosis YouTube, you will see this, Dr. Fishman's method, 12 poses versus osteoporosis. Dr. Fishman has actually shown that these 12 poses can help to immeasurably improve bone density. So if you have a bent toward yoga, I would definitely check this out. I get a lot of questions here about something called OsteoStrong, which is heavily marketed in our area here in Boulder County. OsteoStrong, people go basically for about 15 minutes a week, and using 4 machines try to develop essentially isometric muscle strength. And there's a small amount of data that says that this can be helpful for bones. Now, on their website, they talk about dramatic improvements, but what I will tell you is that the data that they have comes from 9 people. I believe they were women. I'm not 100% sure about that as I'm chatting right now, but 9 people who had bone density measured before and after treatment. And each of them had a small improvement in either hip bone density or spine bone density. You can see not everybody responded at each of these sites, but there was an improvement in bone density that occurred. Now, whether this 9 people extrapolates into the whole population, whether this results in a reduction of fractures, I really don't know. So what I would tell you about OsteoStrong is I think it's really intriguing. If you have the budget and the time for this, I think it may be a worthy addition into the armamentarium, but perhaps not at the substitute of other things that have been proven to help reduce fracture if that's what might benefit you the most. Now, when we talk about treating osteoporosis, so if you've been diagnosed with osteoporosis, everything that we just talked about, calcium, vitamin D, weight-bearing exercise, tobacco, no excess alcohol, muscle mass, balance, safe environment, all of these things still apply. They are all very important. And these things often can help to preserve bone density. They don't typically increase bone density. They may help to preserve bone density, but for some people, medications to reduce the fracture risk can be beneficial and should be discussed. So let's talk about those. So what I will tell you is that bone medications, osteoporosis medications, are not as scary as the internet says they are. Kind of like statin therapy for cardiovascular disease, I think osteoporosis medications have, in certain corners of the internet, a bad reputation, and unfortunately some of that is based on misinformation. So let's talk through that a little bit here. We typically think about who might benefit from medicine if you have had a prior fragility fracture, so you've been diagnosed with osteoporosis on that basis. You have a T-score that's minus 2.5 or below, or a calculated risk of fracture above 3% at the hip or 20% for major osteoporotic fracture, or if you have low bone mass and you're on steroid therapy or perhaps estrogen blocking therapy for breast cancer, something else that's going to cause low bone density to be accelerated, then we might think about medication to help preserve the bone density and reduce fracture risk. So we know that there are medicines that are known to decrease bone breakdown. So first and foremost are what are called the bisphosphonates. These go by names like alendronate or risedronate. The trade names for these were Fosamax and Actonel. And these are typically taken once per week or once per month orally, have to be done in a very particular way, which we will talk about. Should we be starting those in you, have to be done in a very particular way in order for them to be effective. There is an intravenous version called zoledronic acid or Reclast, which is given once per year IV. And somewhat similar, a related type of medicine that works in a different way called denosumab or Prolia, which also decreases bone breakdown, is given every 6 months in the doctor's office like a flu shot, just an injection underneath the skin. And each of these very effective at reducing the risk of fracture, about 50%. There are other medicines, estrogen, which would be given with progesterone for women who still have a uterus, something called raloxifene or Avista, and something called calcitonin or miacalcin. All might be used in particular circumstances, but generally not our first choices for osteoporosis medications. Now, this picture shows that, if you're driving a minivan down the street, there is a risk that you could fall into a minivan-sized hole while you're driving. It could happen. Chances are it's not very likely to happen. And so when we talk about osteoporosis medications, there are some rare risks. Going back to the oral bisphosphonates, we know common side effects for those tend to be things like heartburn or acid reflux. And not everyone who has a history of that finds the medicines make them worse, but we have to think carefully in that situation. Sometimes they cause muscle aches or bony pain. And there are these rare risks of everything that was at the top of that list, the bisphosphonates and the denosumab, that they can affect the jawbone, something called osteonecrosis of the jaw. Current estimates for osteoporosis dosing is this affects about 1 person out of 5,000 each year, so very uncommon. And for you, if you keep up with your dental health, and in particular, if you will be having work done below the gum line, root canals, extractions, implants, we want to get that done before starting these medicines and make sure that you are well healed. And if you've had that kind of work, we may want to talk with your dentist about whether these medicines would be appropriate for you. But if you have good teeth and you see your dentist on a regular basis, the risk of this is exceedingly low, far outweighed, if we're talking about medicines, far outweighed by the risks that go with hip fracture. Additionally, for certain medicines, particularly those bisphosphonates, when treated for the long term, treated for at least 3 to 5 years, probably more like 7 years, we start to see that some strange fractures can occur right in the middle of the thigh bone. And for that reason, with those bisphosphonates, after we treat you for 3 to 5 years, it turns out you'll have some protection that lasts for another 3 to 5 years. And so typically we will stop the medicine, starting something called a holiday, a bisphosphonate holiday, and you may not need treatment for 3 to 5 years before we would consider restarting it. Okay, there are 2 medicines, teriparatide and abaloparatide. They go by the names Forteo and Tymlos that work to increase bone formation. very powerful medicines given as a daily injection, kind of like an insulin shot. Now, I know for some of you who are kind of nervous about needles, it sounds much worse than it is for most people. A lot of women have told me that, hey, I was really nervous about this, and then I started it, and it wasn't that bad. So if we're talking about this, and we think it's a good option for you, I would encourage you to give it a go for a month before you decide that this is not for you. Anyway, these are very powerful medicines that are typically given for 2 years. They were shown to cause a rare side effect in rats, a particular type of bone cancer called osteosarcoma. This hasn't been seen in people, and the risk of that is exceedingly low, probably near zero in actual humans. But we'll talk about that if we need to, if we're thinking about these for you. The other side effect of these is that they tend to be more expensive. Often covered by insurance, but sometimes these days copays can be relatively high, or if you end up in the donut hole with Medicare, sometimes the out-of-pocket expense can be somewhat limiting. There are financial programs that sometimes can offer support, but we'd have to navigate that again if this is a choice that we are thinking about for you. And then finally, for the right woman, there's a medicine called Evenity or romosozumab that has been shown to actually decrease the bone breakdown and increase the bone formation. It does both, but has a slightly increased risk of cardiovascular disease, and so we choose the people who need that very carefully. That's actually given as a monthly injection. So I would just start to wrap up by saying, as we talk about medication options, again, I want to know your treatment preferences, and most people would prefer to avoid medicine unless it's absolutely needed. But I want to make sure that we're considering both sides of this equation. What is the cost of doing something in terms of side effects versus what is the cost of doing nothing, in particular in terms of those fragility fractures occurring, particularly hip fracture? How big a setback would that be for you in your life, in your circumstance? And how important is it to make sure that we minimize the risk of that happening? I would just conclude with one story. It's one of my more favorite stories about bone health. A 67-year-old woman who had advanced breast cancer and lots of fractures, multiple spine fractures, a hip fracture, and pelvis insufficiency fractures. And she had actually been treated with a medicine that reclassed high doses because of her cancer, high doses of this medicine, and it was actually stopped because of dental issues. And after evaluating her recommended treatment with Forteo, teriparatide, but she declined because of fear of possible side effects. And over the next 2 years, she actually suffered 2 more painful spine fractures and another pelvic insufficiency fracture. And ultimately, she gave in, so to speak. She consented to start teriparatide. And since starting that therapy now more than 2 years ago, she's had no more fractures. And when we were discussing stopping this medicine after the usual 2-year therapy period, she actually has asked if she can continue on this medicine because it's been so life-changing for her. Now, it turns out the label has been changed, and we actually do think about continuous therapy beyond 2 years for the right person, including this woman. And for her, I think this really teaches us that medications should be used like a tool. We don't want to throw osteoporosis medications around willy-nilly. There were lots of people back in the 90s and 2000s who were treated with bone medicines who really didn't need to start treatment. And that properly chosen treatment can have powerful effects, powerful benefits. So when we think about osteoporosis, I like this expression, you know, the best time to plant a tree was 20 years ago. Second best time is now. So again, this is what we've covered: osteoporosis, bone physiology, fracture risk, bone metabolism, treatment and prevention. This is all designed to help get you up to speed as we start to prepare for our meeting together. I'll jump out here from behind the slides and just say, encourage you to make sure you get your registration form and your history form done. That collects a lot of the information ahead of time so that I can make sure that we are, again, spending time at a high level and really zeroing in on what would make our time together most successful, what would be most useful for you to learn from me and for me to learn from you so that we can get you the best results possible. So I look forward to meeting you. Thanks for watching these, and until then, I wish you peace. Take care.